Hi, Camille. Thank you for taking the time out of your busy day. I know you worked all day to come and have a chat with me.
It's my pleasure.
Beautiful. We're going to kind of explore a little bit more about Hopewell. I know not a lot of people are too familiar about Hopewell. So sadly. So I'm hoping that we can just shed some light on what we do, share a little bit about how we got started. And all of this really is for in preparation of Eating Disorder Awareness Week, which is
Coming very soon.
February 1st to 7th. Happens every year. We are doing some specialized workshops that week to offer to the nation, actually. So this is, just a conversation to kind of get us in the right gear, get us in the right mindset for it. And we'll go ahead and get started, I guess. So I will introduce myself just formally. My name is Catherine. I am the program coordinator with Hopewell Eating Disorder Support Center. I've worked with the organization for about a year now, but I was, like yourself, I was a volunteer with Hopewell for quite a bit before that. I started out as a peer mentor, and then I kind of transferred into doing support groups as an assistant facilitator, just helping out with the back end work. And then this position kind of fell in my lap, and I've been here ever since. I think we're coming up on a year now, which is really exciting. But I have my own lived experience with eating disorders, so that's really my big passion for why I want to work in this field. I will continue on eventually to get my Master's of Counseling, but for right now, I'm very content where I am. Do you want to go ahead and introduce yourself? I know you volunteered with Hopewell. I don't know too much about that, so.
Yeah, it's been a very, very long time. So I started volunteering with Hopewell as a mentor and a facilitator. I think it was in 2018, 2019.
Pre-pandemic.
So, yeah, it was a very long time ago. Pre-pandemic, yes, because back then all of the services were in person, not online.
Yeah,
so that was a transition too. I loved it. I loved the community. I loved doing the work, seeing how it changes everybody's lives. And I mean, I got busy doing my master's, so I took a little bit of a back seat during that, but I'm back. And I still love it just as much.
We're so happy to have you back. You're very insightful and amazing that you were with us in a volunteer capacity and then got your master's, which is exactly what I want to do. And then you came back and continued to help us, and we really appreciate that. It's super awesome. I guess we'll delve into Hopewell a little bit more in particular, because like I said, not too many people are familiar with us in general. So we are an eating disorder support center. We were founded in 1999 by, I love this story, by a group of 3 moms. Their daughters were patients at the inpatient program at CHEO for eating disorders, and they appreciated and recognized the benefits, obviously, that came with, having that support from a medical team, medical professionals, but they realized as their daughters were transitioning out of the hospital that there wasn't many supports at the community level, which is where real life happens, right? Once you're out of the hospital, that's really where the really hard work starts. Just navigating life and society and all that stuff. So the moms were inspired just by each other's story, and they came together and they founded Hopewell. They really just wanted it to be a center of hope. They wanted to be able to provide peer
support. I love the name.
Yes. They really wanted to be a center for peer support. So really functioning on that peer-to-peer, lived experience kind of format. Yeah. And we've started offering a bunch of different support groups. We've gotten quite a bit bigger over the last 2 decades. But it's been awesome. Just a place for community education as well, dismantling the stereotypes that exist, and serving all of Eastern Ontario, which is quite big. I didn't realize when I started how vast Eastern Ontario is, but it's technically the Champlain catchment area, and that's all the way from Prescott, Russell, all the way to Ottawa, kind of surrounding areas, a little bit in Quebec. So we serve a pretty big area. As you said, we were completely in person before the pandemic, and now we are mostly virtual, with some exceptions. I'll get into our programming in a second, but we're really just there as, that community level support and making sure people have a solid foundation of support and care. not at the professional level. So that's kind of our background story. I know right now we've been struggling a little bit with registration recently, but that's a huge shock because I think the stat is like 2.7 million Canadians at the moment are affected by eating disorders. 1.4 million of those are youth specifically, which is really concerning. So also not a fun fact, but only 20% of those who get diagnosed with eating disorders are able to access treatment.
I'm not surprised. I don't know in how many details we want to get, but of course, if eating disorders are a spectrum, right? So we have disordered eating all the way to full-blown eating disorders. So oftentimes, sadly, as time goes by and if there's no treatment or no access to
early intervention
support, that type of things, usually the disordered eating will progress over time. If there's other factors into play, risk factors, it will develop into an eating disorder. But sadly, you can't access the intensive treatments that people might need to prevent the eating disorder to develop unless they are into very specific criteria.
Yeah, it's really sad and really unfortunate, but that's why we exist. That's why support centers like us exist, to be able, like I said, to provide that support at, maybe a step back. It's not as intense, but still filling in those gaps of care. That's like our big mission, is just to fill in the gaps of care that exist in that, area between hospitalization or medical treatment and society.
One thing I did really enjoy about Hopewell is that, one, it doesn't ask for formal diagnosis, and two, it is very conscious of financial difficulties.
Yeah, so all of our programming offers a pay-what-you-can option. We recognize that a big chunk of, only 80% of people who aren't accessing treatment, a big reason for that is financial constraints. Private treatment is so incredibly expensive. So yeah, all of our programs, they are very accessibly priced. They're like $50 for 8 weeks, 90 minutes each session, run by qualified, accredited individuals, whether they're a registered psychotherapist, dietitian, what have you. They're super qualified and passionate about what they do. Our groups are $50, so that's not that expensive, but we also totally recognize that is a lot of money for some people, and we never want cost to be a barrier to treatment. So if you can't, if you're not in a situation that you can fork out $50, no questions asked, just let us know, and we will happily cover the cost, which is something I'm very prideful about working at Hopewell.
Yeah. Well, kind of to get into some of the statistics. Donc, habituellement, on peut voir que certains troubles alimentaires commencent dès l'âge de 13 à 14 ans. Donc, je parlais un petit peu plus tôt que c'était important de justement reconnaître les signes et les symptômes des troubles alimentaires parce que c'est important d'intervenir puis de faire la prévention le plus tôt possible. Puis, en général, on dit que quelqu'un ou un jeune va démontrer des signes ou certains comportements, pas nécessairement un trouble de l'alimentation, mais certains comportements ou difficultés au niveau de l'image corporelle, ça va affecter à peu près une personne sur 10. Donc, Hopewell, c'est un organisme à Ottawa et dans les régions environnantes d'Ottawa qui sert les personnes qui ont des troubles alimentaires ou qui ont des comportements apparentant aux troubles alimentaires. Et non seulement ça, mais il offre aussi des services aux proches, donc les amis puis les familles. Il offre des groupes de support. Donc ça peut prendre la forme de justement des groupes d'or, des groupes de discussion, des soirées sociales pour briser l'isolement des personnes qui sont prises avec ça parce que justement quand tu as un trouble alimentaire, ça devient très isolant. Puis pour faire un petit peu comme une comparaison, pareil comme avec les troubles d'abus de substances, c'est vraiment important dans le processus de rétablissement des troubles alimentaires d'avoir justement cette connexion-là à la communauté. Puis c'est ça que Hopewell offre. Donc, non seulement il offre des groupes de support, mais aussi il offre justement cet espace-là pour discuter des choses que justement ces personnes-là n'ont pas nécessairement la place de parler à l'extérieur. Le financement de Hopewell vient principalement de subventions du gouvernement et de donations. Donc, c'est vraiment important. Hopewell dépend du public en partie pour justement subventionner puis subvenir aux services qui aident la communauté. Donc, justement, en parlant de la semaine de sensibilisation aux troubles alimentaires, Hopewell offre une série de webinars pendant la semaine. Et puis, ça sert à justement non seulement faire des connexions entre différents organismes qui travaillent avec les troubles alimentaires au travers du Canada, mais ça sert aussi à justement permettre au public d'avoir accès facile à plusieurs ressources et à de l'information pour la prévention. Hopewell offre aussi beaucoup d'informations à la communauté, donc qui vont dans différents milieux, soit dans les écoles, dans les milieux de travail, pour justement aider avec cette sensibilisation-là. Donc, Hopewell, vous pouvez avoir accès aux services à travers de leur site web, où ils ont aussi des réseaux sociaux. Mais c'est quand même facile de justement s'enregistrer pour un des webinaires qu'on va donner cette semaine-là, ou de s'enregistrer pour un des groupes de support qu'ils offrent.
As a nonprofit, we really rely on donations. That's heavily what we, how we kind of get our income, how we're able to keep doing all the programs and supports that we do. Our other main form of financial support is through grants. We do apply for a lot of grants at the provincial level. With that being said, we don't have any sustainable funding. So that means from a year-to-year basis.
Yeah, that's how nonprofits work.
Yeah. So that is a really big challenge, because if you don't get approved for the grant you applied to, that kind of takes out an area of programs, services, which is really tough also, because it's a lot of other really important organizations who are applying to the same grants. But like you said, that's kind of the way of nonprofits. But grant writing is a lot of work. It's a lot of, reviewing and analyzing stats from our programs, the impact that we've had, and really advocating for ourselves and trying to get our point across, our message across, that we do help a lot of people. And financial support monetary support is really crucial to us continuing our organization. It's also really critical for us to continue being able to offer our Pay What You Can program, which not every organization is able to do. But like I said, I'm so proud to be working at an organization where cost is just not a barrier. It's a really nice feeling. It's very encouraging. But yeah, we rely on government funding for all of that grant writing, and donations. Those are our two streams of income. So both are just as important as the other. And the community support also feels really, really nice, of course.
Yeah, that's one, I guess, area of funding for nonprofits that I find unfortunate, because it puts all of those support system that all needs the funding against one another.
Yeah. Yes, that's the worst. Yeah, the competitiveness. There is a bit of competitiveness in the nonprofit sector.
And then sometimes that's how people fall in the cracks too, because if their program that they relied on no longer exists, where do they go?
Yeah.
And then for donations, it's important for people to directly donate to Hopewell, if possible, rather than through like third parties.
Yeah. Just to kind of get into, we'll quickly go over just the different program offerings that we have. I won't spend too much time on it because there's a lot. We have peer support groups, like I said, which are that 8 weeks for $50. Just general place to find support with others who have maybe shared experiences or similar experiences. It's a really safe area. It's really nice. Participants come up with the topics that they want to talk about within a safe scope. and they're always so insightful, and the conversations are so fruitful. And we normally get really, really good feedback after them, which is awesome. And we're also able to, while we do obviously really pride ourselves on supporting folks who are affected by eating disorders, that also includes caregivers and family and friends. Yeah. So in collaboration with Anchor Psychological Services in Ottawa, we put on a family and friends support group twice a year, which is really awesome. It's really high praised. We also have social nights, which are really rooted in the fact that eating disorders are oftentimes really isolating. So these social nights are our in-person way to kind of get you out of your bubble and come do like a fun activity. Normally it's craft or expressive arts based, and just be in a room with other folks who get it and do something fun. And it's very indirectly related to recovery, but sometimes I feel like we need those moments of, just relax and not have it be overly about, recovery and those intense conversations. We also have our new speaker series, which I kind of mentioned before, but this is a new initiative that we're doing. Just speaker series. They're workshops, webinars with advocates, professionals, folks who have gone down the path before, and they share either their stories or kind of a educational workshop. It's really exciting. It's very new. We've only had one so far that we actually did with you last week. They all go up on our YouTube, so they're accessible to everybody across the world, which is really awesome. I'm super excited to be having that. We also do community education, so we do a lot of like info sessions. We go to schools with our Celebrate Everybody program. It's a prevention program, so it's geared at really strengthening those protective factors and teaching kids about, how to have healthy relationships and how to consume media in a safe and healthy way. So it's establishing getting the kids on a good ground running, pretty much. We also go to teachers, to workplaces, and do info sessions on eating disorders in general, like signs and symptoms. Those ones they're called Talking About Eating Disorders. We'll normally contextualize it for wherever we're going, whether it's for teachers or for a workplace or something. So that's also pretty fun. And then we also offer navigational support, which is a pretty big piece. The healthcare system is really complex and really complicated. So we are there just to be a helping hand and kind of guide folks through the process. We have a treatment providers list on our website, which shares all of our local Ottawa treatment providers. There's a really cool filter option that lets you pick based on like financial, like method of payment, a specific type of treatment provider, like social worker, dietitian, therapist, XYZ. It's a really awesome tool. We also have a resource tool on there that helps people navigate just all the downloadable content that exists across the web. So there's a lot of stuff, hopefully, that people can access to get them started at least. And we're always available by phone to do like intake appointments and just have a conversation with folks to get them started. Yeah. And you also have fundraisers during the year because, of course, as a nonprofit, fundraisers are a big part of that. Yes, that is the biggest part of our I don't know if I can say income, but the biggest part of how we, are able to continue providing the programs and the support that we do is through fundraising. We do this through a big Breaking Bread, Breaking Stigma event every year. It's super fun. We normally have a bunch of chefs come out. They have different sandwich stations. Little competition. It's a really nice night just to get the community involved in our mission. A lot of like-minded individuals who are just really passionate about, breaking down stigma and getting rid of those, horrible narratives that exist still. So yeah, it's super fun. I love it. We just had it and it was in October and it was very, very successful. I'm sad you missed it. Yeah. That's okay. Next year. Exactly. So with eating disorder awareness coming up, we wanted to just kind of briefly go over some stats, kind of get, on the same page with the conversation. So right now, crazy stat, 1/3 of Canadians report having thoughts and behaviors that are consistent with the development of an eating disorder, which is really concerning. Going back to the stat that I shared earlier, only 20% of those people are actually accessing the care that they need. People who are already at a high risk for developing an eating disorder are also likely to have really poor mental health. normally they're like 2 times more likely to develop depression, anxiety, substance use disorder. So we really want to make sure that we're getting in there early and, you know, preventing and supporting these folks when these issues arise. Like I said earlier, also youth are a really vulnerable and at-risk population for this. They're really susceptible to media and like societal like norms and all that kind of stuff. So we need to be very protective of that.
And puberty is a difficult period.
Yep. Not even considering all of the other added factors that are in society for youth today. Like, it's absolutely insane. So as I mentioned, we did see a huge spike in eating disorders during COVID. I know you said you worked with Hopewell. Pre-pandemic. During the pandemic, there was a huge rise in hospitalizations. I think women rose by like 66%, men rose by 44%, which is absolutely insane. We also saw a huge rise in people accessing our organization. We had wait lists for almost all of our programming. It was really intense, and it was so unfortunate that we couldn't, you know, allow it for everyone to be in there, but support groups really function well at like that 12 to 15 kind of mark. But it was, that was a really intense time. And
just kind of to give a little bit, I guess, of context to why it rose so much is because eating disorders thrive in secrecy. And so if a lot of individual were stuck kind of at home on their own, or not necessarily being around as many support system as they used to, it's not surprising.
It's like
that
a perfect storm.
Exactly, that those behaviors would emerge or amplify.
Yeah, exactly. That big rise in eating disorder rates in the hospitals is a really, you know, pronounced fact, I guess, or it pronounces the fact that we need more efforts at that early intervention and prevention
and outreach programs.
Yes, exactly.
And one of the problem too is that hospital programs, like, they do have very, very limited space. So the case that they do see are very severe, but they have very specific criteria. So a lot of people with atypical eating disorders do not have access to those services. And as you've mentioned before, even people that access those services, once they get out of the hospital, sometimes lack resources to continue that recovery. And even if they do, like, end up going back to access, you know, like, go see their doctor and inquire about something, physicians only have something like 5 hours worth of training. I know,
like,
it's
specific
crazy.
to eating disorders throughout their 4 or 5 years of medical school. So doctors aren't that, or primary care providers are not that well equipped to be dealing with this stuff. They don't feel well equipped at all.
And some of them will contribute to eating disorders in, as you said, unhelpful way.
There's a lot of weight bias, especially with the atypical eating disorders. There's a lot of just assumptions that are made that aren't accurate.
Especially when some people who have eating disorders also have medical issues or comorbidities.
That just adds to the complexity of it. And unfortunately, the primary care providers they just don't have the tools in their toolbox to support their patients as best as they can. In connection with that, publicly funded eating disorder programs have huge wait lists, like potentially years long, which is just kind of more time for someone's relationship with, like, their food and body to get worse.
And eating disorders have so many, like, medical side effects, and it is actually one of the highest mortality rate of all mental illnesses, more than depression, more than PTSD. So it's not taking as seriously as it should.
No, it's not. That high mortality rate is it's because of the physical complications, and then also the mental strain that comes with it. Most times, if you have an eating disorder, you have anxiety or depression or something. And then on top of that is, like you said, those physical complications that come because you're dealing with your body. So really, really sad, but it's good to be aware of these things, which is why we're having this conversation today, shed some light on this stuff. in preparation for Eating Disorder Week, which is February 1st to the 7th every single year. It is a national movement. It's all across North America, but we kind of consolidate it to Canada just for our support center purposes. National Eating Disorders Awareness Week is a week to raise awareness for eating disorders, foster understanding about eating disorders, and then also combat the very harmful and negative stereotypes that come along with it. Yeah. It's a week that we can, just try to educate the public as much as we can. Have a little moment. But it's going to be my first year working for Eating Disorder Awareness Week, so I'm pretty excited. We have a lot of stuff planned. So like I said, eating disorder support centers across Canada and other mental health organizations team up to celebrate Eating Disorders Awareness Week. We come together and we share resources. Different landmarks are lit up purple across the country. You can probably see one if you're near a city center. It's really fun. We also make sure we emphasize available supports and making sure that we're advocating for meaningful change at the community level and at the provincial level, all that good stuff. Like I said, it's a collective effort, so it's very holistic. We all work together, all the eating disorder support centers. We, like I said, work together to raise awareness and foster that understanding and just make a whole week out of it. Big emphasis is that eating disorders affect people of all ages, bodies, all races, all body types, all genders, all of that stuff. That tends to be something that is forgotten or just assumed, I guess, otherwise. So this year, the theme for National Eating Disorder Awareness Week is Emerging Possibilities, which is to highlight a bunch of the support centers' new programs, new initiatives that are aimed at underserved groups that just aren't really getting the traction that we hope. So this year, NEDIC, National Eating Disorder Information Center, that's Canada's nationwide support center for eating disorders, has teamed up with a bunch of the support centers across the country to organize a support groupathon, which is pretty much just all of the offerings that different organizations have for eating disorders up on one webpage. So you can find it all in one place. It's super digestible, super easy to read. And all of these workshops this year are focused on these underserved or dismissed populations. So we're actually hosting a group on the intersection of substance use and eating disorders. This is an area that is, or a demographic anyways, that is very complex. It comes with there's more underlying factors that are related to it. And it's complex. It adds to the complexity of the disorder. So we're going to have a really cool workshop on that on February 6th from 7 till 8 p.m. All of the information is on our website. It's also on NEDIC's website. And then we're also hosting a renowned author, speaker, peer mentor. Her name is Betsy Brenner. She's going to be doing a workshop or info session on eating disorders in midlife. So she was in her mid-40s when she got diagnosed with an eating disorder and just recognized that there wasn't that much support for people her age, unfortunately. They often take up that maternal kind of relationship even with other people in recovery. So they don't get the full effects of recovery. So she's going to have a really awesome talk about that. We're super, super pumped, super excited. But like I said, there's so many different workshops that are being offered across Canada. So I would highly encourage you or anyone else who's interested to check out NEDIC's website. Yep. You can literally just look up Eating Disorder Awareness Week, and it should be the first tab that comes up. There's also some other webinars that are going on. They have some community education materials. So it's going to be good. It's going to be a busy week, but it's going to be good. Yeah.
Yes. I'm so excited.
Yeah, I'm so happy that you're able to help us out with that. It's going to be a good discussion. So really the main purpose of Eating Disorder Awareness Week is just to, like I said, have that moment, have that week where you just really focus on educating yourself. That is the most important thing I think you can do, whether you know someone who has an eating disorder or you don't. Educating yourself on the signs, symptoms, different types, proper language to use, safe language to use with people.
Because there's a lot of triggers when you work with eating disorders.
Yeah, and just being aware of the language that you use and how it can affect different people is really important. And, you know, we hope that this week highlights that for you and encourages people or inspires people to go check out and read up on these things. And because, like I said, education is the number one. It's the best thing that you can do to support other people. Of course, there's also volunteering. You can volunteer at so many mental health organizations or eating disorder support centers during Eating Disorder Awareness Week. There's so many ways that you can support. Especially
since in the treatment of eating disorder, especially if you're looking at younger clients, family is such a big part of that recovery process, and a lot of emotional coaching takes place during that. Donc, la semaine de sensibilisation aux troubles alimentaires est du 1er février au 7 février. Puis pendant cette semaine-là, on va offrir différents services. Par on, je veux dire Hopewell. Donc, il va y avoir 2 webinars. Ces webinars-là sont aussi accessibles en ligne pour n'importe qui veut y avoir accès. Et dans le fond, c'est une initiative par NEDIC. Puis c'est une collaboration entre différents organismes qui travaillent avec les troubles alimentaires au travers du Canada.
It's going to be, like I said, very busy week, but lots of stuff going on. It's all the best stuff. All of it's free, so very accessible to everybody. Just a few hours out of your week. It can help, you know, yourself or someone else down the way. So super important. And then, of course, if you're able to, like we mentioned earlier, donations are a very, very big way to support eating disorder support centers. We really rely, as nonprofits, we rely on that. So this is also a week for us to raise awareness for that, encourage people to donate if they can. We totally recognize the times that it is. So like I said, if you can't donate, there's so many other ways that you can participate in it. Make sure you check out for purple lights across the city, because normally they have them in whatever city you're in. So with all of that being said, I know we kind of covered a lot of things, but I hope people just have a good understanding of who Hopewell is, who we serve, how we can help. Totally encourage people to check us out on our website. It's just hopewell.ca, nice and easy. You can see Camille as well on our webpage under our Meet the Facilitators section, and just get a good look at all of our programmings. And if anybody has any questions, my email is also all over the website. It's programs@hopewell.ca. Folks can reach out to us there. We're also available by phone at 613-241-3428.
And you also have social media accounts.
We also have social media accounts. That's just Hopewell Ottawa. We have Instagram, Facebook, YouTube. Like I said, where all of our speaker series stuff goes. We're also on LinkedIn. So if anybody wants to make any connections on LinkedIn, reach out to us.
Sounds good.
Beautiful. All right. Well, thank you, Camille. This was a nice little chat. I hope you have a great rest of your day, and I will see you soon.
Yes.
Okay.